As far as the patient experience, they are usually intrigued by the technology. Some of them has some hesitancy when we tell them that they have to retrieve the capsule themselves. But after we show them how it's done and how easy it is to do, they feel better with it, especially when we tell them that this will give us more data that will help guide their therapy and improve their health condition. And usually, after I talk to the patient, when they come back, they are amazed how simple it is as far as the process of retrieval of the capsule.
In my case, I often used a hospital-based system. The patient would have to make an appointment at the hospital, go to the hospital, return the vest to the hospital. This is time. It's not only my time, it's the patient's time. And we've completely eliminated that factor with CapsoCam Plus.
Usually, there is initial reluctance until they see how it's done, and there's really no negative feedback after they are done with it. So, overall, I think the patients are very satisfied with the retrieval success rate of getting the capsule back.
Patients are actually empowered the more they get to participate in their study. And I have found the retrieval to be an absolute nothing for them. It's easy. They understand it. It's intuitive. The magnetic retrieval device and the basin that's provided for the retrieval are very easy to do, and we've had absolutely zero trouble with it. And they see the overall convenience of having that product in their hands. They're the managers of their time.
Before I started with CapsoCam Plus, I was a little hesitant about the retrieval system. Certainly it's different than the other capsule systems that are available today that have recorders. When I first started offering it to patients, I thought they would be resistant about the system, and they actually were very open to capsule retrieval. It's easier for my office staff with workflow. It's easier for the patients because they don't have to be hooked up to a recorder and they don't have to come back that day to drop off the recorder. So the convenience is significantly better. The patient experience I find to be much better because the patient does not have to wear any bulky hardware. They do not have to come back to the office to return the hardware on that day. It just yields a much better patient experience for the capsule endoscopy.
For my practice, this was a system that allowed patient convenience. I did not have to refer the patient out. I could do it right in my office. That's where they swallow the capsule, and then they come back to me and I give them the results. That was really nice. Did I have to get capsule to do this? No, I could continue to refer out. But the inconvenience of referring a patient somewhere else where they really don't care about that patient made it very appealing to me, and I've enjoyed that part of it. I'm able to take care of my patients. That's what I want to do. When I was referring out, I didn't think they were really getting the care they needed to have.